What's happening, everybody? It's your man Dave DNYDC. It's two mics up. Man, we here, we live, man, and we haven't done this in a while. And I really wanted to come back with something that, it was really educational, something that was really deep, that really impacts, so many women in our community. And, tonight's guest that's going to be joining me on the mic, is an awesome, you know, human being, an awesome woman. And really, she's, pioneering, if you will, conversations that really need to be had in our homes and in our community. And I'm just excited that, she's going to take some time out of her busy schedule this evening, to discuss, some of these real topics. And I mean, these are real topics, when we're talking about, maternal mortality, here in the United States. And we're going to really talk about more about women of color, and I think that's really important. So, gentlemen, if you're paying attention, if you're watching, please share this with other men, but sit down, with the women in your family, gather around, and let's really dive into tonight's topic. It's really important that we share this, together as a community. Without further ado, ladies and gentlemen, I'm going to bring to the mic, tonight's guest, you know, Carolyn Curtis, of the Carib Company. Carolyn, thank you so much for taking time out of your busy schedule to join us this evening as we go live. How are you doing today? And I love your smile. The smile is just everything. How are you doing this evening, Carolyn?
I'm doing great, and it's such a pleasure to be able to be on your show. Thank you so much.
Well, thank you, one, for the work that you're doing. I mean, and we're really going to dive into that like tonight because you have so many things that you're going to share with us. You have programs and different things that are coming up. But before we really dive into that, Carolyn, I always like to start to really get to know the person, before we get into the profession, if you will. And I always like to start with the real basic question off the top. You know, well, who is Carolyn Curtis? Like, who is she every day?
Well, I'm a little country girl. I grew up in St. Mary's County, Maryland. The proud granddaughter of Abraham and Florine Butler. I'm going to say that because my grandfather was a visionary, very much involved with the education movement. And my parents, Andy and Bernard Curtis. There were four kids, two brothers, both have gone on, and then my sister and myself. And my sister, I would put in a little plug. She's excessively involved with jazz in the country, music festivals. So I'll talk about that another time. But we grew up basically, in the country, an extended family situation where grandparents were next door, aunt was next door, cousins next door. So we had family all around us, and family that hard working and believed in education. My parents sacrificed a lot for us to receive our education. So that's me. I'm a little country girl.
And look, and for those who may or may not remember, and if you don't know, we had her sister on, Jazz in the Country. I'm not going to give y'all all the details because if you want to go find out more, you go back and you find the episode where we talking about Jazz in the Country, and that's her sister, who was so kind to reach out to us and really give us some history on her sister Karen and the very important work and sensitive work that she's doing. So thank you, Joan. Shout out to Joan for making this connection. Now,
Yes.
being a country girl, Carolyn. So then, what is it that you like to do when you're not consulting or really working, to enrich the lives of other families, if you will, as it relates to improving, maybe healthcare systems? What is it that you like to do in your free time?
Well, I will say I'm a woman of faith. That's one.
Okay.
I enjoy singing. I sing.
Wow.
I've sung ever since I've been in high school and in different school choirs. I continue to sing in church music ministry wherever I am. That's one thing that I enjoy. I am a news buff. My sister hates that, but I'm a big news buff. Watch the news. But the other thing is, one thing I'd like to do on my bucket list is flip a house. I
Okay.
enjoy looking at HGTV and looking at all the different kinds of dynamics of changing things around, and that's something I would enjoy doing. So at some point, maybe. I do sewing, but I haven't done that for about a year. But it's a great outlet to be able to sew and read. Those other nice hobbies that I enjoy.
I, who knew? You never know, Joan. You might actually take over the world and become the next HGTV star, flipping
You know
houses,
what I
right?
mean? That's right.
So,
Yeah.
transitioning then, right? Because with all of that, you coming up in a lovely home with family, loving to sing and all of those things. For you to get into the space that you transitioned into, like, was there like, I like to call them an aha moment, or was there a situation or a story that really impacted you enough that really made you want to delve, into, midwifery and, healthcare and educating others? Like, was there a moment that you can pinpoint or share with us that kind of hit that light and kind of pushed you in that direction?
I was one of those kids who knew what they wanted to do when they were a little kid.
Oh, wow.
When my mom asked, "What did you want to be?" She said, "You were the only one who could answer that." I always wanted to be a nurse. And if I wasn't going to be a nurse, I wanted to be a dancer. So that was, but it was a calling. I feel it's a calling that I have. I wanted to be a nurse. I didn't have any nurses in my family. My family was mainly educators.
Hmm.
Um, and ever since I was a little girl, I wanted to be a nurse. I actually started my nursing studies when I was in high school. I had completed all of my credits for college and started LPN school when I was in high school, my last semester of school.
Wow.
And I knew I wanted the bachelor's degree because I wanted to advance in the area of nursing. And so I did a year of LPN training, which I'll never regret.
Okay.
Then went on and got my bachelor's degree. But I also had a great interest in obstetrics and gynecology in high school. So when I was in college, I knew I wanted to be a midwife, and I was already looking for midwife schools when I was in college. Um, in regard to how did I get into this education space, I did my midwife training first, and then you worked, and then I went on to get my master's degree. And as a minor was education, adult
Mm.
education, and I took that as a minor. Just to let you know, for midwife training, what's involved with that, all of these particular areas that you talked about, reproductive health care, gynecology, family planning, midwives do that. A lot of
Mm.
people don't know that when you go to a midwife, you're able to get generally holistic women's health care.
Oh,
So
wow.
I can take care of you not only during pregnancy, labor, birth, but I can follow you up. I can do your GYN care. I can do your family planning. I can do all of that. I can do primary care. And I have a relationship with a doctor. So if anything happens, we can have that conversation. You can be sent to a doctor or specialist. But my license does not require that I'm under a doctor. I'm licensed in Maryland and in Washington, D.C. So a lot of people don't know that. So when you say the term midwife, everyone is only thinking about pregnancy. They're like, I don't know a midwife. I don't really need a midwife. Now I'm like, oh, yes, you do.
Uh-huh.
GYN, GYN concerns, family planning, midwives are able to do that. And a lot of people
Ooh.
don't know.
I,
Um,
I one right here did not even know that it went to the extent that it goes to. And like you said, was that just 1 year you were saying that just to be able to, that's the LPN portion, but the midwife, like, is there an
Yes.
extended period of
So
training or recertification that you have to go through?
most definitely so. So, as a midwife, when I did my midwife education, you had to be a registered nurse.
Mm-hmm.
You had to have had some experience working in labor and delivery or obstetrics before you were admitted into midwife school. I did my training at Georgetown. Most midwife schools are anywhere from 2 to 3 years.
Oh wow.
Um, and that's to get your master's degree. You then have to sit a huge exam, just like lawyers take their boards. We have to take board exams.
Mm.
And then from there, you then have to be licensed in whatever state. So I carry two licenses. I carry a license as a registered nurse, and I carry a license as a nurse midwife. You will hear the term advanced practice registered nurse, and that term is used for nurse midwives and also for nurse practitioners.
Oh.
So it's a lot of education. And the other thing is that in midwife education, it's not just the number of hours that you do. You have to do actual numbers of cases before
Mm.
you can complete. So I can't just, okay, I'm gonna go in, do the theory, I'm good. No, you have to do, when I was graduating, I'd have to go back and look at now, you had to do 20 bursts before you can
Oh
finish
wow.
school. Do
Wow.
a certain number of antenatal, prenatal visits, a certain
Mm.
number of post-delivery visits, a certain number of pediatric visits. Midwives, depending on where you are, can actually do newborn care up to a year.
Oh wow.
So, again, depending on what state you're in, some midwives do circumcisions. So we have quite a great scope of work, but a lot of people are really totally unaware of that.
I'm saying exactly, like, I'm sitting here where I'm wow, because I did not really, again, and being a representative of the male counterparts, first of all,
Mhm.
never really thought that it was that intensive, and
Yes,
didn't really know the breadth and scope, really,
yes,
of the work and the training that is involved to just, and I don't want to say just but the midwife is, that's a specialty or a
it is.
specialist, um
Yes.
that really kind of goes beyond birth as well,
Oh,
right?
yes.
And
Yes.
that can go, for an extended period of time, I guess, depending on the client or the patient, and maybe what their needs or what they think that their needs are going to be, or like, how
Mhm.
does that work, or how is that diagnosed? I don't know if there's a diagnosis, but like, how does that work with the client?
So I can follow a woman prior to her having a baby or even becoming pregnant. I can
Mm,
see her for GYN, so I can do your physical examination. I can do your
mm.
GYN exam. Um, I can have this conversation with you about wanting to get pregnant and what
Oh
you need to
really?
do. Okay.
Okay.
Um, then really, guide you through the pregnancy, but I can see you throughout your whole life cycle.
Mm.
So I have seen women in their 70s for care. And I've also taken care of
Wow.
teenagers. So it's the whole gamut that midwives are able to do. And so we're the specialists in normal. The doctors are the specialists in problems. They see problems everywhere. We see normal
Okay.
everywhere. Okay.
Okay. I got it.
Yeah.
Okay. Now that's a clearer understanding. Um
Hmm.
and when you say normal and problems, right? Because what I want to try to do is really move to, like, what you are really, in our conversations, thing that we're really focusing on, if you will, and that is the high rates of maternal mortality for women of color, specifically Black women.
Yes.
um you've gone through and you explained, midwifery and things like that, but you've also taken that to another level, where you're starting, your YouTube channel and other programs. And I want you to take a moment to share with our audience and those who are watching it, and even on the playback, to go back and listen, some of the topics and things that you talk about, on your channel, and what are the benefits. Because I want to talk two parts, the education part, and then if you can speak to our men, and what role can we play, in support of, our women as they're going through, their maternal process, if you will.
I'm going to actually move the men to the primary spot right now
Okay. All right. Let's do it.
because they have a primary role.
Okay.
Um, the studies will tell you that when men are involved, that women will get prenatal care earlier. They will
Hmm.
start their prenatal care in the first 3 months of pregnancy.
Wow.
When men are not involved, then that is an issue. I did some study when I was working on my master's program. I found this to be very interesting. There was a theorist who worked with a lot of pregnant women. And
Hmm.
the finding that she had is that women will go through, just like children, or not children, but we all go through different developmental stages in our lives. As you move from a child to teen to adult, all these different developmental stages. Well, in her work, she talked about how in pregnancy, there are developmental phases that women will go through, and they're interdependent. But the
Hmm.
one that is really that stands out that will make the pregnancy either be successful or not is the acceptance of the pregnancy by the significant other. And
Hmm.
that's generally the father of the baby. Okay.
Okay.
If there,
Wow.
if there is acceptance of the pregnancy by that significant other, it makes everything 1,000 times better. But when
Wow.
that doesn't happen, then this is when women may tend to look towards abortion as the resolution for that pregnancy.
Wow.
If they're not feeling that they are having that. The other is the sense of support. That if women are not feeling that sense of support, it makes it hard for them to be able to move through these different developmental phases that they go through during pregnancy. So men have a critical role. And as I talk about things, even I was trying my best to engage men a lot on my YouTube channel. I actually have a couple of episodes just talking to dads,
Hmm.
just involving men. The other thing is we know from the research that black men make better fathers than white men.
Okay. Now, see, now you definitely caught my attention. Now, hold on now. Go ahead. Let's talk about it.
Yeah. Of course, we got the media and everything else, but the
Mm-hmm.
media is not real life every day. I see
Okay.
this when I look at my nephews with their children and, my brothers with their kids. They're
Mm-hmm.
intimately involved with their kids.
Right.
Black fathers are the ones who tend to be there more so for their children than white fathers.
All right
And
now.
so we need to embrace men through this entire journey. Now, so I'm putting dads first, and
Okay.
then I'm going to try and kind of go back to your initial question, and I might ask you to pose that one more time.
Well,
But it's
it's
so critical for men to be there from day one. From day
all
one.
right. Okay. Well, that part, I mean, and I'm glad that you started with that because I think it's really critical, right? Because
Yes.
so, and I say this because so I didn't have my dad, growing
Mm,
up, right?
mm,
And
mhm.
everything that I didn't have from my dad, I wanted to make sure that I put that into my children. And the Lord
Yes.
saw that I had a daughter. He knew what he was doing when he gave me her because she
Mhm,
got my life right. And
mhm.
it's like what you say, I feel that I poured everything that I could into my child for all the lack of things that I didn't have. Now there were some things obviously I could have did better, but
Of course.
for the long haul, I think I did
Yes.
a great job. I'm glad that you shared that because we do have this misconception at times that the media draws that black men are not involved uh, in their families and in their homes. So I'm glad that you spoke to that. The other
Yes.
side of the question was, we were focusing on, due to the high rates of maternal
Yes.
mortality,
Yes.
you
Yes.
know, and your role in your YouTube channel, which was one of your stepping stones, if I'm safe to say, of creating your message. What are some of the other things that you talk about for our women who are watching or listening that they can go see and really get educated on and be able to reach out to you for additional information, help, and service?
So when we look at why women are dying, those reasons, all of them are preventable reasons.
Mm.
Um, I have can break them down. Mental health, I was very surprised to know that that is the major reason for maternal deaths. When
Wow.
we talk about maternal deaths, we're talking about during pregnancy up until 6 weeks after birth. Okay.
Mm. Mm-hmm.
Think about that 6 week checkup. A whole lot goes on during that time.
Wow.
And so mental health is 23% of the reasons why women are dying. Suicide, opioid addiction, all of that. That affects white and Hispanic populations more than Black. But
Mm.
for Black populations, our women are dying from hemorrhage. And the other is cardiovascular disease. And when you look at what's part of all that cardiovascular stuff, that includes high blood pressure. That includes what probably might be known as the term toxemia, which is what's called preeclampsia,
Oh,
which
okay.
can develop into eclampsia, which will take you out of here quickly if you're not on top of it. It's very, very serious, happens very quickly. Um, what I would say is that if we begin to understand our family's health, our own personal health, then we can come up with what are our health risks for ourselves.
Mm.
Now, if think about yourself, if you think in your family, I'm going to talk about men. If you have a family history, say, of prostate cancer in your family, as a man, you would probably think about that as a possibility more happening in your life, right?
Right. Right.
So if you have in your family, uh, a number of people with hypertension, high blood pressure, um, you could actually develop high blood pressure. You may be at a higher propensity for developing high blood pressure.
Mm.
And it may not show its face until you are pregnant. And why is that? In pregnancy, women's bodies, I just want men to know, women's bodies are off the chain. What we're like super women, okay? We can grow babies, deliver babies, do all. But what I want to say is that during pregnancy, you actually produce 50% more blood that you needing to
Mm.
pump through your body, which is
Wow.
going to yeah, because you got a baby that's growing, you got a bag of waters, uterus, breast developing, all of this going on.
Mm.
You're pumping 50% more blood through your body than when you're not pregnant. That puts more stress on your heart.
Right. Mm-hmm.
That just kind of makes sense. That's just one example. And
Right.
so if you had not had, and when you got to, just think about it. I got to pump more. Good grief. That means
Mm.
more pressure, right? To
Yeah.
be able to pump that blood.
Right.
Well, if you have this propensity for high blood pressure, it may show up in pregnancy. And
Mm.
before 6 months, we can say it's hypertension due to pregnancy.
Mm.
If it's after 6 months, then we start worrying about other things such as the preeclampsia and the toxemia. And once
Wow.
you have that in pregnancy, that is something that you can carry on later in life. Same thing with diabetes. If you have a family history of diabetes,
Mm-hmm.
again, all the changes happening in your body, you may not have had a problem with diabetes, but pregnancy might kick that in. And so
Wow.
if you develop that during pregnancy, you actually later in life have an increased risk of getting diabetes So it's needing to know your body, needing to know your history.
Mm-hmm.
And so this is what I'm really wanting to work on is let's look at what's going on. Let's understand ourselves, understand our health. Because if we understand what our health risks are and we know the reasons why women are dying, then let's help reduce our
Mm.
risks so that we're not
Mm.
one of those statistics, okay? For those things that are preventable. The other things are blood clots. The other is if you actually have a heart defect in the tissue itself. These are the main reasons for why women are dying. And for Black women, it's hemorrhage, it's
Mm.
preeclampsia. These are the big ones. So the cardiovascular diseases for Black women. So these are the ones that
Wow.
we need to watch out for.
Eh,
I talk about hospitals,
mhm.
and often we'll go to the same hospital our family members went to.
Yeah.
We don't know their history. We don't know, are they a good hospital for maternity care? And so there is actually a way to find that information out. There's a whole lot of info online. And so I want to say, let's look at possibly doing some homework ourselves and finding
Mm.
where does this hospital stand in terms of cesarean section rate? Where does it
Mhm.
stand in regard to being a baby-friendly hospital? Because I'm going to say this, I'm the boss. I'm paying y'all.
And you know, you touch on two things that really, for me, just listening,
Yes.
when we're talking about, our health,
Yeah.
and learning your, I guess, predisposition, if you will, your
Yes.
genetics.
Yes.
Can we, or is there a way, or would you suggest, um, you know, and you're 100% right, excellent information, because I'm my mind is going a mile a minute, and I'm trying to get my thoughts, because it's really important. I think, you know, we talk about diet then, right? So if you may be predisposed to certain things,
Mm-hmm.
our diets and health is really important. And this is really, I don't, it's really a touchy subject, but some are less fortunate than others. So are there
Mm-hmm.
tips and things that that you're able to share with people who may be a little bit in a tougher class, um, to be able to try to work on their diet and their health,
Yeah,
to kind of maybe work through or knock off some of those, hopefully, predispositions, so that during the pregnancy they don't experience some of those challenges.
exactly. So one is understanding your health history. And
Mm-hmm.
this is something when we talk about my coaching program that I'm going to cover in that.
Mm-hmm.
The other is I want to throw, this is where I need dads to really help out. And this is this whole idea about weight gain in pregnancy.
Mm-hmm.
That's the idea that because I'm pregnant, I'm eating for two,
Right.
right? No, you're
Right.
not. Okay. As I would
Right.
say to my moms, okay, you keep on. You're going to be, when this pregnancy is over, it's going to be you, and you.
Wow.
Okay.
Wow. Right.
We can account for 24 pounds when it comes to the baby, the
Mm-hmm.
weight that is the extra blood that we talked about, the
Mm-hmm.
weight of the uterus, the extra weight in the breasts. We can account for only 24 pounds.
Wow.
So if mama says I'm eating for two and we're gaining 50,
50. Right.
okay,
Wow.
right,
Okay.
you don't have 25 pounds left on you when this is over and done.
Wow.
Promise. So the other thing is knowing um, your body mass index.
Mm-hmm.
That is going to be the determinator of the amount of weight that you should gain.
Mm-hmm.
And it's based upon your height and your weight.
Okay.
And so I can no longer say, oh, okay, the average weight gain is 25 to 35 pounds. I can't say that anymore. It
Mm.
depends on what is your weight before the pregnancy starts. So if I'm overweight, if I'm obese, and they even have they got 3 classes of obesity with this BMI,
Oh wow.
you may
Mhm.
not be able to gain any more than 10 pounds.
Say what?
Yes, sir.
What?
Yes, yes.
Wow.
And so when I practiced, I did a lot of work working with our young moms, not just young moms. I just like, okay, let's look at this now.
Mm-hmm.
You want to have and you, or what you want to do. So,
Wow.
so it's important to know your BMI now because
Right.
we're looking at what is everything before you become pregnant.
That's okay. So with that, then, too, you also spoke on. So you want to be the boss of your healthcare, and I get it. And through my situation, my trials, right now I'm sitting here, I can hear my wife's voice in my head about certain things. How? what's going to happen. And I can even hear her talking about, and if it's me, make sure that you do this. So, but then again, though, we're also going to go on the flip side. Some of us are not as fortunate, and really don't know, how to go search and go look,
Right.
for hospitals, if you will, healthcare professionals, if you will, that are
Right.
really, I don't know if the word is appropriate, but that are certified and qualified, that
Right.
really you should be going to.
Exactly.
Do you also educate others, about that information too? Because that's really important.
Yes.
And could you talk a little bit more about that? Like, where should, like, if we're here in the DMV area, like, for example, and I don't want to say certain hospital, but like, are there better areas or better doctors or practitioners that maybe you talk about that? I see you nodding. Can you kind of just talk about that, for those here in the DMV area?
I'll give you an example. So
Okay.
there are things online, and again, this is something that I do cover in my coaching program.
Mm-hmm.
The question is how far are you willing to travel to get the care that you want?
Okay.
Now, down in St. Mary's County, Maryland, where I grew up, everything down there, hospitals are level 1, 2, 3.
Mm-hmm.
3 is your big teaching hospitals that you find in your major cities. 2 is your intermediate, like I'm thinking about. I'm not familiar with the hospitals in Virginia, but here we've got in Prince George's County. It's now under the University of Maryland, but it was the PG Medical Center.
Okay.
That's a level 2 hospital. Level 1 is your county hospitals. They can
Okay.
only carry you so far, and then they don't have the specialists. Okay.
Gotcha.
So my question is, how far are you willing to travel?
Mm-hmm.
That's the first question, because if you're willing to travel a certain distance, you can probably get more of what you want.
Got it.
I looked at I looked at the hospitals down in St. Mary's, Calvert, and Charles County. And the information you can find online will help you know what is their cesarean section rate.
Mm-hmm.
Are they a baby friendly hospital?
Mm-hmm.
And what is their actual hospital safety grade?
Mm. Hmm.
And what I found was interesting. We're talking 30 minutes in one direction or the other
Mm-hmm.
from our house down in the
Wow.
country.
Wow.
3 hospitals, all within about a 30-minute drive. One hospital, which everybody thinks is the better hospital down there, had a 42% cesarean section rate. What does
Oh,
that mean? The likelihood of me having a C-section for not a good reason is real high.
right.
The other one had a cesarean section rate of 27%.
Okay.
And then the other one had a cesarean section rate of around 31.
Mm.
And we're all in 30-minute radius. People can't be that different.
Right.
It makes you ask questions. Only one of those hospitals was baby friendly, and that was the one with the lowest cesarean section rate.
That's crazy. That is so crazy.
And
And
so often, yeah,
uh,
a lot of times we'll choose the doctor and then they're the ones who are driving you to a particular hospital because that's where they have hospital privileges. But I
mm-hmm.
would suggest maybe looking at where you want to have your baby first, and hospitals are not the only place for safe delivery. Um, Figure that out first, because generally they're going to have physicians associated with them
Mm.
or
That's,
midwives.
and it's so weird because I'm sitting here, like, again, epiphany. Never thought of it in reverse, right?
Yes. Yeah.
Never thought of it that way. But the bigger thing for me that really stands out, that I have to ask, like, being a healthcare professional, being like, why is there such a huge disparity in these numbers, like you said, from basically hospitals that, like you said, are a 30-minute, I guess, general vicinity, the numbers and the service, if you will, and the rates of care are just so skewed. Like, is there any one thing or two things that maybe I don't want to say you can attribute, but can be attributed to that in our healthcare system?
Well, I think that's a good question to throw out, because that's a question I'd like to put in the local paper down there.
Mm.
Say, Southern Maryland News. Why is this that? Like, help let's understand, I can throw out some thoughts from my work, having been in hospitals for over 20 years, is if you don't have a teaching program like a teaching university, then you may not have the same amount of coverage, physicians covering each other.
Mm-hmm.
And cesarean sections happen many times for not a good reason. They happen
Mm-hmm.
because it's Friday at 5 o'clock, okay, or it's, I'm serious. I'm very serious when I say
Okay.
these.
Okay.
There is a reason to figure out, well, you're not progressing quite so fast, or there are reasons that cesarean sections are done that may not hold up to water. It doesn't
Mm-hmm.
necessarily have a firm reason as to why. And the other is that there was this thought at one time, I think it's calmed down a bit, where instead of going through labor, let's just schedule our cesarean section.
Really?
Let's just schedule cesarean sections. So of
Wow.
course, yeah, and the physicians would go along with that.
Wow.
So let's, instead of going through labor and enduring labor, and I'm not going to just say endure because it sounds like it's such a harsh thing, but instead
Mm-hmm.
of having the experience of labor, we have put so much fear about childbirth into the public. You're like, oh, I don't want to do that. Let me just have, and people do not understand or think cesarean section is major surgery, major surgery.
Mm-hmm.
And
Mm.
major surgery has its risk and complications.
Sure does. You know a lot about that. Yeah,
But
and
because it's done so often, we just think it's okay,
it's
normal.
normal. It's
It's not.
become normalized.
Yes, yes.
Oh my goodness. Well, I thank you for really delving into that, because again, there's so much information, and mind blowing information, in that, and from that, I want to spin into, your project, you know, your you mentioned your coaching program,
Hmm.
and I'm excited to hear more about it. I'm excited, to let you go ahead and educate and talk about that. So, please go ahead and just go ahead and walk us through, where you're moving forward with in your coaching program, and how can our audience and people who watch or listen to this later, how can they get involved and help?
So, um, as someone who has worked in hospitals for over 20 years,
Mm-hmm.
I kind of know what goes on. I've also worked mainly in public hospitals. I worked at DC General Hospital before it was closed down.
Mm-hmm.
Most of my career there. Um, I've worked in teaching hospitals like GW Hospital, and I also worked at a place called Booth Maternity Center in Philadelphia, which totally flips everything on its head because they treat you like you're normal instead of your problem, or
Mm-hmm.
that you're going to need a cesarean section the minute you walk in the door. From that experience, I feel that there are things that we just need to kind of take. You have to kind of like stop it and say, "Hold up, now. Let's
Mm.
stop and take control of some of this."
Right.
Um, what is happening is a lot of disrespect of women. Now, this has been going on since
Mm.
slavery, so
Right.
we don't
Right.
seriously.
Right.
And I've got a couple videos on my YouTube channel that talk about racism in medicine, because I'm going to relate that to informed consent, hospitals, and all that.
Mm-hmm.
Um, but I feel that we need to really take control, because when I worked, I directed the midwife service at DC General Hospital, and I made sure that there was adequate time to see patients. An
Mm-hmm.
hour for a new appointment. You have a lot to do. An hour, 30 minutes for a return appointment.
Wow.
That means that I'm actually giving you time. We can actually
Time.
talk
Right.
to each other, okay?
Right.
That
Right.
doesn't happen anymore because we now have these conglomerate healthcare systems that, it's no longer individual physician practices. Everybody's bought out by these huge
Huge. Yeah.
systems,
Yep.
and they are driving their money. I mean, it's no longer medicine; it's a business.
It's a business. Mm-hmm.
And so, instead of providing care, we're providing a transaction.
Mm.
All
Mm.
right. I'm gonna give you 15 minutes of time. You got to go zip, 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 zop. And
Right.
the other thing too, what came out of the Centers for Disease Control when they were looking at maternal mortality review committees across the country, one of the things that came out in terms of why maternal death is that there are too many providers seeing one person. And when
Mm.
you have too many people, nobody knows you. Nobody
Oh
knows
man.
you.
Wow. Wow.
Even when you go into a group practice now, most times women will go into a practice that may have, 5 providers. Well, they
Mm-hmm.
think that, oh, well, since we don't know who will be there when you have your baby, you should see everybody.
Oh
Well, they
wow.
might, yeah. And so you've got 5 different people who have not sat and taken time, reviewed your chart, looked at what's going on. So I feel that we need to really understand our own health. We need to know what works for us. We need to know our own normal,
Mm.
because your normal is not the textbook normal. It's not the
Mm.
population normal. And so, therefore, if I know what my blood pressure is, I will be able to pull your coattail and say, well, no, no, this is what it was. Because preeclampsia is a very subtle rise, can be a very subtle rise in the blood pressure. But sometimes before you get to see it, it's gone up a lot.
Right.
Well, it's gone up a lot because nobody's paying attention.
Attention to it. Mm.
Yes. Yes. And so if I know my own health, if I know my own blood pressure, if I know my own weight, then I can pull your coattail and say, well, this is what's going on with me.
Right.
What's happening in the healthcare system is that women are not believed, they're not respected. Actually, I looked at a study yesterday that was just published in October. They looked at 9 million deliveries. And of those 9 million, 57% of the Blacks are the ones who are dying in the hospitals. Okay, 57.
What? 57%?
Yes. And
My
the other
God.
is that of these Black women, 17% talked about the disrespect they experienced, the lack of autonomy, where, oh, we're going to just tell you what we're going to do.
My
So I
goodness.
feel that we need to take our reins back. We need to get
Right.
our voices back. And we need men involved to help us
Hey,
do this.
look. I'm sitting here listening. I mean, it's blowing my mind, these numbers, and I mean, I've heard it, and I think I've experienced it once or twice. And I'm a firm believer. Nobody knows your body better than
Except
you
you.
do, right?
Exactly.
And if that doctor doesn't want to listen, then you got to push until you find a doctor or a healthcare professional that is going to take the time to listen. But you touched on so many things now, these conglomerates, and like I think about even now, like my doctor at one point he was in an affiliate with other doctors. You
Hmm.
know what I'm saying? And it's I got to go through this whole hoop thing to be heard. Where coming
Exactly.
up, my doctor knew me.
Exactly.
We sat, we it felt like we sat and we talked for 25, 30 minutes before we really got, to okay, Damon, well, look, what's really going on with you? We caught up
Hmm.
on life and different things.
Exactly.
Uh Now it's so dollar driven.
Yes.
You're like a cattle card number,
Yes.
coming through the station. And
Yes.
I love that you say, and I hope that there's men out here. I see. Thank you for everyone for taking time to join. I see you in the weeds, and I thank you for your comments. But I hope if our men are out here, go back and listen to this if you missed the first part, and really get involved in
Mhm.
helping support the women in your life. Doesn't that necessarily have to be your wife or your daughter? It could be your mama, your auntie, your cousin, because
Yes.
we need to get back to this community thing to really help our women and support our women through
Mhm.
these trials and tribulations that they go
Mhm.
through childbirth. And
Mhm.
I'm glad that you shared that, because this is so uh it's mind blowing to me. It's so educational,
Mhm.
with that and your coaching program. that you're working on, that is going to actually highlight and share all of these ways that we can continue to fight and push forward? And is
It
there
will.
anything additional?
So the other is then to help you be able to understand how to find the ratings on where. My first question that I would ask for families, and this is a question that when I worked in Philadelphia at Booth Maternity Center was asked of every family. Every
Mm-hmm.
family had to have a birth plan. And the
Mm.
question presented to them on their first prenatal appointment, this was a whole different place. Okay. I've never worked anywhere else like it ever again.
Mm-hmm.
The first question was, so what do you want your birth experience to be like?
Oh, wow. Wow. What kind of
What
question
do
is
you
that?
want
What
your
kind of
birth experience to be like? Okay.
question is
And
that?
as and it was to say, what do you want? You know, they saw women as being normal, and you had to show us that there was a problem. Otherwise, we treated you as normal. This is 1980. Women ate,
Jeez.
drank, walked. Very few wanted to have their baby in the delivery room. We had babies, I mean, just lowered lights. Um, some families wanted prayer. And I've even had a birth, even at DC General Hospital, with a dad who he said, before you say anything, I want to pray over my baby. And we
Mm.
honored that. That was
Mm.
special for that family.
Mm-hmm.
There may be cultural things that are important. Um, that's goes into, what do you want your birth experience to be like? Even when women had cesarean sections, we got the babies to them as soon as possible. We didn't hold them out over in the warmer and you see your baby an hour later.
Right.
You got right away, skin to skin contact with the mom. Um, and we were, as a staff, required to meet that family's desires as much as we could, because things
Awesome.
happen in labor that you can't control.
Right.
And so, you might have, pie in the sky, and then life happens in labor. But then
Mm-hmm.
you still, what are those special things that make a difference?
Mm.
Now, so we talk. That's my first question, because to get to that, then you have to be proactive. It's not going to just happen.
Gotcha.
Be
Gotcha.
proactive, which means that you are the person who makes. If you understand your health, if you start looking around at different providers, and safe providers are midwives.
Mm-hmm.
They're safe providers.
Hmm.
They work in hospitals. They work in birth centers. They deliver babies at home. A lot of
Wow.
people have thought, oh, home birth is unsafe. Not true. Not if it's done properly.
Mm.
When I say properly, that means that you are not trying to do this by yourself.
Mm-hmm.
When I have worked with my girlfriend, she has a midwife practice in Alexandria, Virginia, called Birth Care and Women's Health. She has done home births and birth center births for 30 years.
Wow.
She has provided care, delivered 4,000 babies in this practice,
Wow.
never lost a mom.
Oh,
Okay.
wow. That's amazing. Wow.
That's
Wow.
because she's careful. She's careful. There's protocols that are followed. She doesn't play. There are times when you need to go into the hospital. So just because you start at home, or even in a birth center, there may be reasons for you to go into hospital. But all
Right.
of that is prearranged. It's not like fly by night, seat of your pants. It's all done properly and well. So,
Wow.
and then also to look at your insurance. There's a lot of things that,
Mm.
do you know what your insurance covers? Home visits.
Hmm.
You don't have to be sick for a home visit. You want to make sure everything's good. And now, when I ran a teen pregnancy program in DC, we used to do 5 home visits on teen moms.
Oh, wow.
3 prior to the 3, like 28 weeks, 36
Mm-hmm.
weeks, and then after they had their babies. They're more at
Mm-hmm.
risk because they're kids.
Right.
Uh,
Right.
but insurance does pay, but they don't let you know, and your physician or they usually don't even think about that. They're not going to think
No.
about that.
No, not wow. I,
Doulas are covered by insurance in some country and some states.
states.
So yeah, and the doulas are support persons that can help. So it's to also look at all these other things and based upon what you want, but also based upon your health. You have to
Mhm.
be safe about this. And I'm not going to suggest that everybody comes out of the hospital, not suggesting that at all, but find a hospital that's going to support what you're wanting. And it's possible when you look at baby friendly, when you look at cesarean section rates, all of these things can help guide you. And they
Mhm.
all are going to have providers who are attached to them because very few people are practicing on their own anymore, not like they used to.
Not like they used to. You're right. And Carolyn, look,
Yeah,
I have to be honest. I mean, you are, and loving you. You are a beast. I mean, you are
yeah,
a plethora of information. I'm really enjoying it. But I do want to ask, with everything that you do and everything that you discussed and through
yes.
your journey and your experiences, and I think this is really the biggest takeaway and question that I want to ask is, in what ways, do you see, the positive impact of your work, with whether it be clients, in their growth, navigating, through today's healthcare system, because it's a journey, it's a continuous journey. But what positive impact have you seen or maybe heard, or you have a story that you can share? Because I think it's important that we also hear that, because we want to get that positive side as well.
Mhm. So, this is new for me, the coaching program. I've also worked in an international arena. Um, when I worked at DC General Hospital, my goal was to bring home into the hospital, meaning that try to avoid unnecessary interventions. Let's
Mm,
say that. Okay.
mm-hmm.
Does that mean that you can't have pain medicine? Not at all. It means to use the appropriate level of pain medicine at the
Right.
appropriate time. Does that mean you can't have an epidural? Not at all. It
Mm,
means having dads there even when they're scared to be there, encouraging them to come and be a part. And I say, you know what? I promise you, I promise, if you feel faint, then I'll let you go. And out of all the years, and I'm talking 20 some years in a hospital, I think I had maybe twice when a dad was weak,
mm,
had to sit down.
mm-hmm.
Men think, oh, it's going to be blood, da 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 da.
Mm,
It's an experience you'll never, ever have again.
you never lie about that. Mm,
Yeah. So encouraging fathers to be there. Working, I have, uh, I have functioned kind of as a doula for a couple of families in my church, and I know that I made a difference in their labor with
mm-hmm.
being. I actually went to someone's house and was there for 2 days to be with
Wow.
her, to just calm her down, to help her get through the early part of labor. Come like, all right, I'll see you back. I, and then she went on and had a beautiful birth at a hospital. But it was just trying to help her in that early part. Even with my pastor's wife, I've been with them on 3 of their births. And it's to help kind of, as I say, stave off the unnecessary crazy stuff and really work with them to keep things as normal as possible, to help them have the kind of birth experience that they're looking for and
Mm-hmm.
wanting. So on an international thing, I have been able to help change policies around family planning after women have miscarried or
All
had
right.
abortion, to ensure
All
that
right.
they are getting family planning to help prevent the next unplanned, undesired pregnancy. So
Mm.
I've been really blessed in my work. I'll say I really have.
You really have, and you've been a blessing this evening. You really don't know, and I'm honored to be able to share this information and get this information out, because it's really needed. And you have really been working on so many different things, and we have one more tidbit that I
Hmm.
want to, because this is important. This part of the coaching program, this is all building up, ladies and gentlemen. If you following along, so I'm going to step back, because I think I'm gonna ask you, and I'm gonna let you take the lead. What's next, and what do we have coming up here in the near future with you and the Carib Company?
So, the launch of my coaching program, I've got 2 webinars to introduce that program. One will be tomorrow night at 8 o'clock p.m. Eastern Standard Time, and then on Monday. And the whole goal of that coaching program is to really help families to kind of take things back, to empower them to, what shall I say? To just have this be your experience, not the
Mm,
hospital's experience, not the medical student's experience. This is a private, beautiful time. Um, and it's being overtaken by too much medical interventions, and
hmm
it doesn't have to be that way. So that's what I'm hoping to do. I feel that if I can just make it better for just a few, it'll make a difference. It'll make a
yeah.
difference. So,
Well, it really will. And I look forward to it and hope to have you come back again, because this conversation, we could have really gone on in so many different directions and continued on. But
yes.
I think this was a great opening salvo, if you will, just really laying some foundation and education. So please know we will be in contact. We'll stay in touch, because I really want to continue to dive further into certain aspects of the work that you're doing, and bring
Thank
you
you.
back to continue to help educate us and our audience. Yeah, thank you. I couldn't agree with you more. This great show, great conversation. Those you in the woods, I see you. I see that. Feel free to drop a comment, join in. Before we get out of here, I'm going to let that sit for a minute. But I do also want to ask for you to share, your website information, where we can go ahead. Anyone who's following, who wants additional information, may want to use your services. I want you to please go ahead and share that, and we're going to go ahead and make sure we share with our audience and drop it down in the show notes before we close out.
Yes. So my YouTube channel is, just go to YouTube, look for Carolyn Curtis, the Carib Company. And I have been putting up YouTube since June. I
All right.
was in a master class that was being done by Jamal Miller and Anthony O'Neill. And their challenge, which I did a big gulp, was 30 years of live events. I'm like, oh, wow, okay.
Wow.
But it was what propelled me. This was brewing in terms of what can I do around this maternal mortality issue. And
Hmm.
my concern was that I know that women are not getting the information that they used to be able to get, at least what I would give if I were seeing you as a client or a patient in front of me. So I'm the information I'm providing is if you were come for a prenatal appointment and I'm sitting down and talking to you and saying, okay, this is what we need to do. Um, I also have my website where you can see. You're able to use the website. It's also the Carib Company. There is where you can find the registration for the webinars, and also as I develop free downloads, I have one up that gives the history in terms of the reasons why women of color are dying when giving birth. I also have one up for signs of labor. I mean, women don't know.
Mm.
And just, again, things that I would be sharing with my own patients if they were sitting in front of me. So that's where you can find things. So they're free downloads. Enjoy. Yeah.
It's in here, ladies and gentlemen. I'm gonna leave the webinar dates. You know, first one tomorrow evening, 8 p.m. And then on the 20th, November, 8 p.m. You can register online. You can see that down there. We'll make sure we drop that in the show notes as well. Please reach out, ladies and gentlemen, especially our brothers and sisters in the Black community that are really struggling. You know, please use tonight's conversation as dialogue and educational, point of reference, if you will, and reach out, to Carolyn, and follow along with the work that she's doing. Educate yourself and reach out to her, man. I mean, this woman has dropped nothing but gems all night. And Carolyn, I really want to say from the bottom of my heart, thank you so much for taking time out to really sit here with me, our audience, and sharing the work and the passion that you're giving back to us each and every day.
Thank you so much. I really, really appreciate the time. Thank you.
Totally been a great show, ladies and gentlemen. So there you have it. We are at the top of the hour. I'm your humble host, Damon Cunningham, aka Dame D NYDC. This is Two Mics Up. If you want to follow me, you can catch me across social media at Dame D NYDC. You can follow Two Mics Up online, IG, Facebook, YouTube, Twitter, and all the other stuff at Two Mics Up. Season 5 is in the books. We preparing for season 6 on the #1 network for positive programming, the Mogul Global TV Network. Stay tuned, though. We're going to go ahead and we're going to ride through the holidays. We're going to do a couple of more lives before we get back into season 6. So thank you, everyone, for joining us. It's been a great time. And like we always do at this time, ladies and gentlemen, I'm going to go ahead and leave you with 3 things. May you stay safe, stay blessed. Mike's out.